My name is Vincenzo Berghella. I'm a physician here at Thomas Jefferson University. I'm currently a professor of OBGYN and director of the Maternal-Fetal Medicine Division and the Maternal-Fetal Medicine Fellowship Program. Maternal-Fetal Medicine being high-risk obstetrics, high-risk pregnancy care. I've been doing this for about 30 years. I care a lot about pregnant women and their babies. There are over 145 million births every year around the world. Many of those occur to women who have issues, even if they are low risk at the beginning. And unfortunately, also babies have issues. So I've dedicated my career to come up with evidence-based ways to protect women from complications so that they can have the healthiest, most beautiful babies. So lots of science has shown that when you use protocols, when you use guidelines for anything you do in medicine, people do better. Patients do better. There are really millions of, in our case, women in terms of pregnancy who have participated in the best science and give us data and information on how to take care of something. Let's take, for example, labor. You can go through labor in many different ways in terms of what positions you're in, when you should push, how you should push, when you should deliver, how you should deliver. There are probably 40, 50 different steps there for which there is evidence. Same thing for how to do a cesarean section. Some women may need a C-section. The incidence in the US about 30%, in the world it's 21, 22%. So millions and millions of women have C-sections. And there are thousands and thousands of randomized trials, meaning of good scientific studies saying how should you open the skin, how should you get to the baby, how should you close the uterus at the end, what kind of antibiotics should you give, when should you, after a C-section, begin to walk or begin to eat, or what should you do with the bandage, etc. Decades ago, doctors used to use their opinion. And in fact, we were in a way a laughing joke of patients who would hear from Dr. A one thing and Dr. B a different thing. Now that we have so much evidence, so many scientific studies saying, for example, that after a C-section, there is no need to be in bed for a long time, but after 6-8 hours, you should walk. After 6 hours, you can even begin to eat. And those studies show that women do better, they're happier, they go home sooner with their babies, have less infection, less blood loss, etc. We should make sure that everybody's aware and we all use the same guidelines, trying to kind of standardize things. Again, everybody's a little bit different, but 99.999% of our DNA is the same. And usually pregnancy are somewhat similar for women, so we should give them the best advice and be on the same page. Another concept with guidelines is the concept of prevention. We actually can prevent bad outcomes. We can prevent delivering too early. We can prevent losing too much blood. We can prevent getting a fever and maybe sepsis ending up in the intensive care unit. So I'm a huge believer in prevention being better than cure. And with guidelines, we do that much better because many times we forget to do something, then the patient gets in trouble, has complications, which we could have easily avoided using guidelines and checklists.